A respiratory therapist is a specialized healthcare practitioner who has graduated from a university and passed a national board certifying examination. Respiratory therapists work most often in intensive care and operating rooms, but are also commonly found in outpatient clinics and home health environments. Respiratory therapists are specialists and educators in cardiology and pulmonology. Respiratory therapists are also advanced practice clinicians in airway management, establishing and maintaining the airway during management of trauma, intensive care, and may administer anesthesia for surgery or conscious sedation. Respiratory therapists are often in charge of initiating and managing life support for people in intensive care units and emergency departments, stabilizing, treating and managing pre-hospital and hospital-to-hospital patient transport by air or ground ambulance. In the outpatient setting, respiratory therapists are often educators in asthma clinics, ancillary clinical staff in pediatric clinics, and sleep disorder diagnosticians in sleep clinics. They also serve as clinical providers in cardiology clinics and cath labs. Clinical practice. Intensive care and operating room respiratory therapists educate, diagnose, and treat people who are suffering from heart and lung problems. Specialized in both cardiac and pulmonary care. Respiratory therapists often collaborate with specialists in pulmonology and anesthesia in various aspects of clinical care of patients. Respiratory therapists provide a vital role in both medicine and nursing. A vital role in ICU is the initiation and maintenance of mechanical ventilation and the care of artificial airways. Outpatient clinical practice respiratory therapists are also primary clinicians in conducting tests to measure lung function and teaching people to manage asthma, chronic obstructive pulmonary disorder among many other cardiac and lung functions. Internationally, respiratory therapists that provide lung function testing are termed respiratory scientists, but in North America, they may be a respiratory therapist or may also be a certified pulmonary function technician in the United States. Home healthcare outside of clinics and hospitals. Respiratory therapists often manage home oxygen needs of patients and their families, providing around-the-clock support for home ventilators and other equipment for conditions like sleep apnea. In the clinic or outpatient setting, respiratory therapists assist with diagnosis and serve as an educator for patients suffering from cardiac or respiratory illness. In the United States, respiratory therapists with certification as registered respiratory therapists evaluate and treat patients with a great deal of autonomy under the direction of a pulmonologist. In facilities that maintain critical care transport teams, respiratory therapists are a preferred addition to all types of surface or air transport. Public education. In other settings, respiratory therapists are found in schools as asthma educators, working with teachers and coaches about childhood symptoms of asthma and how to spot an emergency. In the United States, legislation has been introduced several times to allow respiratory therapists certified as asthma specialists with registered respiratory therapist certification to prescribe and manage previously diagnosed respiratory patients in physician clinics. In sleep clinics, respiratory therapists work with physicians in the diagnosis of sleep-related illnesses. Respiratory therapists in the United States are migrating toward a role with autonomy similar to the nurse practitioner, or as an extension of the physician like the physician assistant. Respiratory therapists are frequently utilized as complete cardiovascular specialists, being utilized to place and manage arterial accesses along with peripherally inserted central catheters. Pulmonary rehabilitation. Pulmonary rehabilitation may be initiated as a treatment as a source for continuity of improvement after a hospital stay or as a therapeutic way to increase quality of life. Pulmonary rehabilitation is intended to educate the patient, the family, and improve the overall quality of life and prognosis for the patient. Pulmonary rehabilitation involves therapies and evaluations by respiratory therapists, occupational therapists and physical therapists. Credentialing and licensure. United States and Canada. In the United States and Canada, respiratory therapists are healthcare practitioners who, after receiving at least an Associate of Science in Respiratory Care, complete a credentialing process. After satisfactorily completing the required examinations and added to a registry, the practitioner is then eligible to apply for a license to practice in the region governed by their respective licensing body. In the United States, specialist respiratory therapists are clinicians who hold National Board for Respiratory Care specialty credentials, which may include neonatal, pediatric specialist, adult critical care specialist, sleep disorder specialist, and pulmonary function technologist. The NBRC's RRTACCS examination is the newest NBRC examination that was launched in 2012. Professional credentials denoted as a certified asthma educator may also be earned by passing the National Asthma Educator Certification Board. In some parts of Canada, one may practice as a provisional respiratory therapist after graduating, until writing and passing the CBRC exam. In Canada, similar credentialing and advanced training exists. International respiratory care. Except for the United States and Canada, very few countries have a dedicated professional role for respiratory health. In these countries, respiratory care is provided by physiotherapists, nurses and physicians that have chosen to specialize in this field. In many countries this recognition is in a transition stage. As an example, in 2011, hospitals in Beijing, China began a recruitment drive to acquire respiratory therapists for their intensive care units where previously nurses were the only clinician. Canada. Upon graduation from an accredited school of respiratory therapy, the graduate is then eligible to write the national exam administered by the Canadian Board for Respiratory Care. Success on this examination will then allow the respiratory therapist to register with any licensing body in Canada, Alberta, Manitoba, New Brunswick, Newfoundland and Labrador, Nova Scotia, Ontario, Quebec and Saskatchewan are the Canadian provinces with provincial licensing bodies. In these provinces, it is illegal to practice the profession of respiratory care without first being licensed as a full or provisional member with the provincial licensing body. These provinces are so-called regulated provinces. In some provinces, one may work provisionally upon graduating, until writing and passing the exam. In all other jurisdictions, the licensing body for the profession of respiratory care is the Canadian Society for Respiratory Therapy. Registration as a full member is optional for respiratory therapists living in regulated provinces. However, for respiratory therapists living in non-regulated provinces, registration as a full member with the CSRT is compulsory. Registration with the provincial regulatory body or the CSRT confers upon the respiratory therapist the title of registered respiratory therapist. Canada and the United States recognize each their cardiopulmonary education structure as equal. However, a qualifying exam must be written in order to practice in either nation. There is pressure for the program to become a degree, as other therapies now require a master's degree or greater. However, in some places such as Alberta, Canada, the cardiopulmonary coursework are only offered at technical schools which are unable to grant a formal degree. France. Respiratory therapy is a subspecialty of physical therapy in France. Respiratory care as a specialty is regulated by the Fédération Française des Masseurs Kinésithérapeutes Rééducateurs. Germany. The German Respiratory Society first issued a resolution to develop the dedicated respiratory therapist role in 2004 as a means to increase the quality of patient care, delegate physician duties and respond to the observed increase in respiratory conditions and diseases. In 2006 to 2006, a year-long pilot training program was offered to established nurses and physiotherapists. Researchers report that significant additional work is necessary to define and position the role of the respiratory therapist within the current healthcare system. Philippines. In Philippines, respiratory therapists are clinicians who have been awarded at minimum a Bachelor of Science in Respiratory Care degree. Licenses to practice respiratory care are regulated by the Professional Regulatory Board of Respiratory Therapy and Professional Regulation Commission, which is established and legally maintained by the Philippine Respiratory Therapy Act. United Arab Emirates. In United Arab Emirates, respiratory therapists must have been awarded a Bachelor of Science in Respiratory Care. An additional 2 years of experience is required for foreign applicants. Licenses are maintained and awarded by the Dubai Health Authority. The Dubai Health Authority restricts respiratory therapists to working only in physical medicine and rehabilitation centers, in hospitals, in surgical clinics with cardiothoracic surgeons and with physicians in family, general practice, or pulmonology. Saudi Arabia. Saudi Arabia utilizes respiratory therapists in a similar fashion to Canada and the US. In fact, many respiratory therapists from North America travel to Saudi Arabia for temporary need. United States. In the United States, a respiratory therapist is a clinician who has at a minimum completed an Associate of Science in Respiratory Care degree along with a certification process. After satisfactorily completing required examinations either administered by the National Board for Respiratory Care or directly by the individual state licensing board. There are 2 recognized governing bodies in the United States, the State Board of Respiratory Care in the state in which a respiratory therapist is licensed to practice, and the other is the National Board for Respiratory Care, a non-profit organization which regulates 2 levels of certification, along with some additional specialist certifications: the Certified Respiratory Therapist and the Registered Respiratory Therapist. The CORT is the certification given after successfully passing the entry-level examination NBRCELE. The RRT certification is given after first becoming a court and then passing the NBRCWRE and NBRCCSE. Most state boards of respiratory care require proof of the appropriate NBRC credential and award various license titles, including respiratory care practitioner, licensed registered respiratory therapist, and licensed certified respiratory therapist. There has been a substantial push to standardize the state licensure by the American Association for Respiratory Care. The NBRC credential is renewed every 5 years for a fee in addition to fees assessed by the state boards of respiratory care. United Kingdom. Respiratory therapy in the UK is not a recognized specific profession, but a specialization route available to physicians, nurses, physiotherapists and occupational therapists. Common titles include cardiorespiratory physiotherapist, clinical respiratory physiologist, respiratory nurse and cardiorespiratory occupational therapist. All UK-trained physiotherapists receive advanced training in respiratory therapy theory and practice as a core component of their pre-registration physiotherapy degree program. Following qualification and a period of rotations throughout the core areas of physiotherapy practice, they may then follow a career pathway specializing in respiratory physiotherapy. Areas of practice include critical care, respiratory medicine, cystic fibrosis, asthma, hyperventilation syndrome, general and specialized surgery, non-invasive ventilation, ventilation weaning, cardiac and pulmonary rehab, respiratory therapy outpatient clinics and community respiratory therapy. The Association of Chartered Physiotherapists Interested in Respiratory Care is the specialist interest group for UK physiotherapists working within the field of respiratory therapy. All physiotherapists working within the United Kingdom must be registered with the Health and Care Professions Council, regardless of their area of clinical practice, in order to be allowed to work in both the public and private sectors. Respiratory physiotherapy postgraduate master's degree and PhD programs exist within the United Kingdom for suitably qualified and experienced therapists. For respiratory physiologists, a Bachelor of Science in Clinical Physiology is issued with a specialist option in respiratory physiology. Beyond degree level, Master of Science programs in respiratory care, respiratory disease management, advanced cardiology and clinical respiratory physiology are available.